Hello, my name is Elizabeth Gardner, and I'm going to present on Healthy People 2030. So, Healthy People 2030 is a set of objectives and goals for that decade, working to build a healthier future for the United States by setting up a framework promoting health and avoiding preventable disease. As I said, it's for the United States, so it's a national strategy to improve the health, and it is released by the U.S. Department of Health and Human Resources, and it is a set of objectives that is reassessed each decade. What's changed since 2020 is that the average life expectancy has increased by 2 years, and it is now 78 years old. And the death rates for heart disease, stroke, and certain types of cancer have also declined since the last Healthy People 2020 edition. However, the one issue is that health disparities between whites and minorities still remain. So the top 5 topic areas of Healthy People 2030 is health conditions, health behavior, populations, settings and systems, and social determinants of health. And so one objective under nutrition and healthy eating for the objectives of Healthy People 2030 is increase vegetable consumption by people aged 2 years and older. So vegetables are recommended as a key part of a healthy diet, but most people in the United States do not eat enough vegetables, and evidence suggests that nutrition counseling, school and workplace-based programs, and school nutrition policies will help increase people eating more vegetables. So the reason it's important to track this objective is because the data allows people to understand that people are not eating enough vegetables, thus allowing for people to be motivated to change their habits. And this is a baseline objective with 0.7 cup equivalents of total vegetables per 1,000 calories, being the mean daily intake by persons aged 2 years and over in the years 2013 to 2016. And the planned method for evaluating progress is the target of 0.8 cup equivalents, as compared to what I just said in the last slide, per 1,000 calories as well. The data source that was used was the National Health and Nutrition Examination Survey, and the data was collected with the collection of one-day dietary data from all the respondents through in-person 24-hour recalls and collection of second-day 24-hour recall by telephone. Another objective was reduce consumption of added sugars by people aged 2 years and older. So added sugars in foods and drinks can make it hard for people to metabolize the nutrients that they need without getting too many calories. So when too much added sugar is consumed, you can be put at a higher risk for tooth decay and obesity and several other diseases. And many people in the United States do still consume too much sugar. And pricing strategies and education interventions in schools may help people limit the foods and drinks they have with added sugars. So that is a method. And then encouraging people to use nutrition facts labels on their foods to track their consumption of added sugars is another important part of the objective. So the reason this objective is important to track is because there are negative effects from consuming too much sugar, and as I said, Americans do consume too much sugar overall. So tracking the data allows to grow an awareness of the overconsumption of the sugar, and it can allow for action to benefit from others. This is a objective baseline with 13.5% being the mean percentage of calories from added sugars consumed by persons aged 2 years and over in 2013 through 2016. And the planned method for evaluating progress includes the target of 11.5% being the mean percentage of calories. The data source used was the National Health and Nutrition Examination Survey, and the data was collected by clinical examinations, selected medical and laboratory tests, and self-reported data. And then the third objective I'm going to talk about is increasing the proportion of schools that don't sell less healthy food and drinks. So this objective is still in its developmental status, meaning it's a high priority public health issue that has evidence-based interventions to address it, but it does not have enough reliable baseline data yet to allow it to become part of the objectives. But once that data is available, it can be considered to become a core Healthy People 2030 objective. So this objective is important to track because children go to school every day, and if they are surrounded by unhealthy food every day, they are much less likely to make healthy food choices, thus affecting the health of thousands of children in the United States. This is a developmental objective because it's still being worked on, as I mentioned. And the planned method for evaluating progress towards the objective is also an ongoing process as the objective is still being developed. The data source used, so the members of the Educational and Community-Based Programs Work Group have expertise in areas including school-based health centers, K-12 school and workplace health programs and policies, and medical/allied professions training curricula. They developed the objectives related to educational and community-based programs, and they will provide data to track the progress toward achieving these objectives through the decade. So Growing Fit, that is a program that was listed under Healthy People 2030, and it is working towards increasing vegetable consumption by people aged 2 and older. So to preface, about 75% of U.S. children under the age 6 attend an early care education program. So in Georgia, Growing Fit was created. It is a training curriculum and toolkit to help early care education programs, or ECEs, create, implement, and improve on their wellness policies and practices, particularly around physical activity and nutrition. Growing Fit teaches child care providers to evaluate and, in some cases, write wellness policies to identify areas to improve physical activity and nutrition practices in their centers, to collaborate and make those improvements as well. And when a center meets or exceeds the DECAL's quality rating and improvement system standards, then that center will get recognition, a marketing boost, and additional classmate resources from state agencies, thus to help promote these practices. Growing Fit began offering technical assistance to help centers draft policies and to understand why the policies are important. So they're going above and beyond to make sure people understand why they're doing what they're doing and why what's being implemented really matters. And as I said, the quality rated standards are also being upheld, and they're partnering with organizations and individuals who have experience working holistically with ECEs around healthy eating and physical activity, including academic institutions, child advocacy programs, and a pediatric hospital. And so, because of Growing Fit, 302 early childhood environments in the state have adopted the toolkit, and over 1,270 staff have been trained. And so this means that over 39,318 children are benefiting from the policies that give them more physical activity and healthier food during the day. Right, and that is all. Thank you.